Okay guys, how are you today? In our Technology versus COVID-19 series, today I thought we can discuss robotics. So when I say the term robotics, what comes to the mind immediately is machines which are capable of machine learning or self-learning, artificial intelligence, that is machines which think like human beings, and deep learning machines which go well beyond human intellectual limits. But in a pandemic like this, these kind of machines would be utterly and completely infeasible, totally impractical. Let's see why. See, at this point of time, the US, United States of America, has over 5 lakh COVID patients. And many countries have over a lakh patients. India has several thousands of patients. Imagine using an intelligent robot to handle patients in this quantum, in this number. It's just ludicrous because these machines cost the skies. The cost of these intelligent machines would run into several crores. Now, how is it practical to have an intelligent machine manning quarantine centers, observation centers across India or across US? Several thousand destinations, several thousand locations, several thousand institutions, and several thousand robots. Is it possible? The answer is simple and clear. Absolutely impossible. Then let's see what is possible. See, I have seen in a hospital in Zion in Mumbai, they have used a smart COVID OPD, outpatient department. What they have done is, they have sealed a glass cabin with sanitation devices or dispensers for sanitizers which are controlled from another room. They have kept a pulse oximeter, a digital thermometer, and an auscultation device, a stat, on the table. And the readings of these machines are available on the computer screen as well as the mobile of the physician who is sitting in the next room. So there is practically no contact. And there are 2 slots with glow compartments through which, if required, the doctor can do a physical examination of a particular part of the body of the patient without entering the room. See, these are actually 2 slots through which gloves are provided. So the doctor inserts the hand through the gloves and examines the patient. Simple as that. So this is foolproof, fine. But then at a point of time, the doctor can examine one patient, and after the patient leaves the room, it has to be sanitized again. The whole process is to be repeated. Okay? And then it's just about OPD. It's not about IPD. The major challenge before us is not the COVID OPD. The challenge is the quarantine centers, the isolation centers, and the observation centers. Let's see how we can use robotics practically. We'll see some of these visuals, screen. So this is our so-called intelligent robot which can do things on its own. It can learn by its own. It can actually do a little bit of programming by itself. This is absolutely not required in a facility like pandemic quarantine. Next slide, please. What is required is a simple remote-controlled robot. A remote-controlled robot would not cost you the skies. It would, you could make it investing a few thousands, and you can produce any number of them. I'll just tell you what the future scenario would look like. Back. Okay, there have been discussions about robotics in pandemics. And there are some interesting nomenclatures which are actually drawn from these pandemics itself. See, there is a line of robotics called SARS. SARS is, as you know, the first one of the earlier pandemics, systemic acute respiratory syndrome. And the line of robotics has taken the same name. It's expanded as socially assistive robots. Socially assistive robots. Okay. And then you have MERS. This is a pandemic which struck us after SARS. You have a line of robotics which is doing research in this line. This is expanded as mechanically empowered robotic systems, MERS, mechanically empowered robotic systems. And then you have another line of research in robotics which is called Ebola. There's another pandemic which struck us. This is expanded as electronic bots for logistical assistance. Electronic bots for logistical assistance. And then of course we have COVID, another line of research in robotics, which is expanded as computerized visual devices. Computerized visual devices. So let's look at the future scenario. See, at the OPD, you have a simple remote control robotic system which has a camera, which has a recording device, and which is capable of gestures which are controlled by the front office staff sitting in another room, completely protected from the pandemic. He or she can see the patient, can gesture to the patient, can record things on the system through a remote control arm, through a remote control camera, through a remote controlled speaking device. See, please note, this robot has absolutely no intelligence. So this at the OP or at the front office, you have what is known as a COVID, that is a computerized visual device. You move to the next level, that is socially assistive robot. See, once a patient is to be examined, he has to be guided to the examination room. This will be done by our SARS, socially assistive robotic systems. See, this is just a remote control robot which actually walks in front of the patient, guides him to the examination room, opens the door for him. Please note, is not an intelligent robot. It's just a mechanically controlled device. Once the patient is inside, there is another robot which you can call as mechanically empowered robotic system, which is just another remote control robot which will check the pulse oximeter reading, take the temperature, auscultate. All this is available to the physician who is sitting in another room. So through making use of the MERS, the doctor can also examine the patient because it's just remotely controlled. And at the next stage, you have your Ebola, that is electronic boats for logistical assistance. Once the patient is admitted, delivery of food, delivery of medicines, monitoring, observation, advice, even counseling, entertainment, all these are handled by an Ebola, that is an electronic bot for logistical assistance. Please note, this is also not an intelligent robot, just a remotely controlled robot controlled by the staff. See, what is happening right now is at the front office, if you appoint an intelligent robot with a face detection system, it will cost you crores just to say hello, John. We have thousands of people who are unemployed. They could do that for a meager salary. Okay?